Spironolactone, commonly known by its brand name Aldactone, is a widely prescribed diuretic with a multitude of benefits and concerns. In this video, we dive deep into understanding what Aldactone is all about, from its mechanism of action to its usage and potential side effects. What is Aldactone? Aldactone is a medication that falls under the class of diuretics, specifically referred to as potassium-sparing diuretics. It is primarily used to treat conditions such as high blood pressure, edema, fluid retention, and certain hormonal imbalances. The active ingredient in Aldactone is spironolactone, which works by blocking the effects of aldosterone, a hormone that regulates fluid balance in the body. By inhibiting aldosterone, Aldactone helps promote diuresis, increased urine production, and reduces fluid retention. How does Aldactone work as a diuretic? Aldactone exerts its diuretic effects by acting on the renal tubules, which are responsible for filtering and reabsorbing substances in the kidneys. Normally, aldosterone acts on these tubules to increase the reabsorption of sodium and water while promoting the excretion of potassium. However, Aldactone inhibits the action of aldosterone, preventing it from binding to its receptor sites in the tubules. As a result, sodium and water excretion increase, while potassium excretion decreases, leading to diuresis without the loss of potassium. The unique mechanism of action of Aldactone makes it a valuable diuretic option for patients who are at risk of potassium depletion, such as those with heart failure or liver cirrhosis. It allows for effective fluid removal while maintaining potassium levels within the normal range. However, this mechanism of action also poses concerns and potential side effects, especially concerning potassium levels in the blood. Benefits of using Aldactone. The primary benefits of using Aldactone are associated with its diuretic properties. It is widely used to treat conditions characterized by fluid retention, such as congestive heart failure, cirrhosis of the liver, and kidney disease. By increasing urine production, Aldactone helps reduce edema and relieve the symptoms associated with fluid overload, such as swelling, shortness of breath, and fatigue. In addition to its diuretic effects, Aldactone has gained attention for its off-label uses in treating acne and androgenetic alopecia, also known as male or female pattern hair loss. Acne is often influenced by hormonal imbalances, particularly an excess of androgens, male hormones. Aldactone, through its anti-androgenic properties, can help reduce the production of androgens and, therefore, alleviate acne symptoms. Similarly, androgenetic alopecia is linked to the effects of androgens on hair follicles. Aldactone, when used in low doses, can potentially mitigate hair loss in individuals with this condition. Concerns and potential side effects of Aldactone. While Aldactone offers significant therapeutic benefits, it is not without concerns and potential side effects. One notable concern is the risk of hyperkalemia, a condition characterized by abnormally high levels of potassium in the blood. As Aldactone reduces the excretion of potassium, it is crucial to monitor potassium levels regularly, especially in patients with renal impairment or those taking other medications that can increase potassium levels. Hyperkalemia can lead to serious cardiac complications, such as arrhythmias and even cardiac arrest. Another potential side effect of Aldactone is gynecomastia, the enlargement of breast tissue in males. This occurs due to the anti-androgenic properties of Aldactone, which can interfere with the normal hormonal balance. While gynecomastia is usually reversible upon discontinuation of the medication, it can cause distress and discomfort for affected individuals. Other side effects associated with Aldactone include menstrual irregularities, dizziness, headache, nausea, and electrolyte imbalances. It is essential to discuss these potential side effects with your healthcare provider before starting Aldactone to make an informed decision. Conditions that can be treated with Aldactone. Aldactone is commonly prescribed for various medical conditions. It is primarily used in the management of hypertension, high blood pressure, as a part of combination therapy. By reducing fluid retention, Aldactone helps lower blood pressure levels, reducing the risk of cardiovascular complications. Another condition where Aldactone is frequently employed is edema, particularly in patients with congestive heart failure, liver cirrhosis, or nephrotic syndrome. Edema, characterized by the accumulation of fluid in tissues, can cause discomfort and impair organ function. Aldactone's diuretic properties help alleviate these symptoms by promoting fluid excretion. In addition to its primary indications, Aldactone has found utility in the treatment of certain hormonal imbalances. It can be used off-label to manage conditions such as polycystic ovary syndrome, PCOS, in women, characterized by excessive androgen production. Aldactone's anti-androgenic effects can help reduce symptoms like acne and hirsutism, excessive hair growth. Dosage and administration of aldactone. The dosage of aldactone will vary depending on the condition being treated, individual patient factors, and the presence of other medications. It is essential to follow the prescribed dosage and administration instructions provided by your healthcare provider. Typically, aldactone is taken orally, with or without food, once or twice daily. For the treatment of hypertension, a starting dose of 25 to 50 mg per day is often recommended, which may be increased gradually to achieve optimal blood pressure control. In cases of edema or fluid retention, the initial dose is usually higher, ranging from 100 to 200 mg per day, divided into 2 doses. The dosage may be adjusted based on the patient's response and potassium levels. When using aldactone for its anti-androgenic properties in conditions like acne or androgenetic alopecia, lower doses are typically employed. A common starting dose for these off-label uses is 50 to 100 mg per day, which may be increased or decreased depending on the individual's response and tolerance. Precautions and contraindications when using aldactone. Before starting aldactone, it is crucial to inform your healthcare provider about any existing medical conditions, allergies, or medications you are currently taking. Certain conditions and medications may interact with aldactone or increase the risk of adverse effects. Due to its potential to increase potassium levels, aldactone should be used with caution or avoided altogether in individuals with significant renal impairment, adrenal insufficiency, or hyperkalemia. It is essential to regularly monitor electrolyte levels, especially potassium, in such cases. Aldactone is contraindicated in patients with anuria, inability to produce urine, or significant renal dysfunction. It should also be avoided in individuals with Addison's disease, a rare endocrine disorder characterized by insufficient production of adrenal hormones. Additionally, aldactone should not be used during pregnancy or breastfeeding, as it can harm the developing fetus or nursing infant. Alternative diuretics to consider. While aldactone is a widely used diuretic, there are alternative medications available that may be more suitable for certain individuals or specific conditions. These alternative diuretics include thiazide diuretics like hydrochlorothiazide and loop diuretics like furosemide. Each type of diuretic has its own mechanism of action and potential side effects, which should be considered when determining the most appropriate treatment option. Thiazide diuretics are often used as first-line therapy for hypertension and are effective in reducing blood pressure. Loop diuretics, on the other hand, are potent diuretics commonly used in conditions where significant fluid removal is required, such as acute heart failure or renal failure. The choice of diuretic will depend on the individual's specific needs, medical history, and the presence of other medications. It is essential to consult with a healthcare provider to determine the most suitable diuretic for your situation. Frequently asked questions about aldactone. Can aldactone be used for weight loss? Aldactone is not approved for weight loss purposes. While it can help reduce fluid retention and promote diuresis, the weight loss achieved is primarily due to the loss of water and not fat. Aldactone should only be used under the guidance of a healthcare provider for its approved indications. Can aldactone be used by men? Yes, aldactone can be used by men. However, due to its anti-androgenic properties, it may cause side effects such as gynecomastia, enlargement of breast tissue, in some individuals. Men should discuss the potential risks and benefits with their healthcare provider before starting aldactone. Can aldactone be used in children? Aldactone can be used in children for specific indications, such as heart failure or nephrotic syndrome. The dosage and duration of treatment will be determined by a pediatric healthcare provider based on the child's age, weight, and medical condition. Can aldactone interact with other medications? Yes, aldactone can interact with certain medications, including potassium supplements, angiotensin-converting enzyme inhibitors, ACE inhibitors, angiotensin receptor blockers, ARBs, nonsteroidal anti-inflammatory drugs, NSAIDs, and certain antibiotics. It is important to inform your healthcare provider about all medications you are taking to avoid potential interactions. Conclusion: is aldactone the right diuretic for you? Aldactone, with its unique mechanism of action and multiple applications, is a widely used diuretic that offers significant benefits for individuals with conditions such as hypertension, edema, and hormonal imbalances. Its ability to promote diuresis while sparing potassium makes it a valuable therapeutic option. However, it is essential to consider the potential concerns and side effects associated with aldactone, such as hyperkalemia and gynecomastia. Regular monitoring of potassium levels and open communication with your healthcare provider are crucial for safe and effective use. Aldactone's off-label uses in acne and androgenetic alopecia have shown promise, but further research is needed to establish its safety and efficacy in these areas. Ultimately, the decision to use aldactone as a diuretic should be made in consultation with a healthcare provider, taking into account your specific medical condition, risk factors, and treatment goals. Thanks for watching.